you so much, everyone, for coming in today to UNT Dallas for our that LSAMP program orientation. So this is going to be the alliance orientation of all 5 institutions across the state. And before we get started with that, we have a very special guest with us today. It is Wildcatters and the WISH Network. And so some of their representatives are here to talk to us. We are very grateful for their presence today. They provided our amazing lunch. Thank you so very much. And they have some opportunities, and we're looking to work with them as a program partner moving forward, because a lot of what they're doing is really impactful and benefits directly the students we have in here today. So without any more of me talking for the moment, welcome. Thank you so much.
Thank you. Thanks, everyone. Thanks, Ian. And just
pop it.
okay, perfect. Is there a camera somewhere there as well?
Yep, it's that right there in the back.
Okay. Make sure enough. And then just give me any idea how many minutes do you have? Just 2 minutes? Not for us.
Yeah.
Oh, really? Okay.
You don't have to speak for 20 minutes.
You don't
have
have
to.
No. We'd love to. I just don't want to hijack.
No, not at all.
Trust me, there is a lot of passion. So we're excited. Okay, well, let's go. Go through these slides. Really, what I enjoy most is speaking about what we do. But to start off with, my name is Hubert Zaitchik, and I'm the CEO of Health Wildcatters, and I'll get into that in a second, what we do. And actually, Javin's going to give me a sign so that I shut off by 10 minutes so we can switch over to the WISH network. And then, as you can see, Javon is on my team, and Lindsay Settles is as well. So we're a lean and mean team. And what we do is we work with early stage healthcare startups from all over the world. And to date, we have invested in 118 of these startups. That means about 10 a year. So we've been doing this. This is our 12th year. We're right in Dallas at the Pegasus Park campus, which is close to UT Southwestern Medical School. And what's important to understand is that it is a group of angel investors. So those are people who might have been further in their career, who might be willing to invest in an early stage startup, get together and pick 10 startups to help by making a small investment, but more importantly, to provide a 3-month program for them. So that's what you could call an accelerator. And so without money, that's not going to work, right? Somebody's got to provide money. In this case, it's private funds from private individuals. And those 10 startups this year, actually it's 9, they were picked out of almost 700 applicants. So all of you have gone through college admissions and or grad school, and it gets very competitive. Well, that would be considered quite competitive. That would be I don't even know the college admission rates, but it's very competitive. So when we get these 10 in, or 9 this year, we work with them for 3 months. We have a bunch of them already, so they've raised over $300 million as a group. And we also have a network of investors and mentors. Actually, almost all of our investors are also mentors. So it isn't, I know an investor, when I grew up, I didn't grow up in this country. So when I grew up, I'd never heard of people with that much money that they can make such investments. But actually, it's not, first of all, it's not that much money. And secondly, those are people, those are people, maybe somebody who's a business owner, owns a roofing business, or a physician. In our case, a lot of them happen to be in the healthcare space, administrators in hospital systems, and so on and so forth. So, but they also want to be involved. So they're not just saying, here, I'm just going to put some money into a stock market or something. I want to be involved, and I want to open my own network to these startups. So everything you're going to hear from here on out is about helping these 9 this year startups become successful. We've done this for 11 years, and let's go to the next slide. Is that the world map? Yeah, it is. It's a schematic world map. So the majority of our startups still come from the United States, but we have an increasing number of startups from elsewhere as well. This year, we have one from Sweden, one from Switzerland, and one from the UK. But our Virginia startup is run by an Austrian, and it goes on and on. So even we just put a flag into the state wherever they were at the time when they applied. It doesn't mean the individuals from there. Our last New York startup was run by two Russians. Our Oregon startup by two Sri Lankans. It just goes on and on. So they can be from anywhere. They may be immigrants. They can be from any group. Some might be physicians or even professors. And we have those. This year, for instance, two Swedish professors. And then we have students who are grad students. We have one right now who's 21, who's still in college from Texas Tech. So they usually have teams. Usually it's a minimum of 2 people involved. So also from our international group, I think we'll have another slide on the exits. So this gives you just an idea of all the people involved. There's many more than just on this slide. These are our mentors. Let's keep going. Here's an important piece, and all I've said so far is about private individuals making investments in startups and then helping them. So, okay, I mean, good for them, right? Well, who cares, you know? I'm not saying you don't care, you care, but I'm just saying it's like, but what gets really fun is that our organization also has sponsors. That means we are a for-profit entity. We run it at a break even. So none of us, obviously a partner, we are not looking to make a profit of our enterprise. Of the investments, yes, but not of the enterprise. But these organizations support us to do things in the community. So the WISH initiative you'll hear about in a minute was born out of that. But we have philanthropic organizations like Lauderdale Philanthropies. Texas Health Resources is a large hospital system. That's also known as a law firm. There's 2 universities you recognize, a bank, an accounting firm, Dell. So a different set of organizations that is willing to support the things we do in the community. And what is it we do? Well, WISH Network is one of them. We are passionate about bringing in, and I'm one of the co-founders of the WISH Network. It started with a hackathon that conceptually I had invented, put together with another person. And then we said, why don't we do this more often? And we do hackathons, so students and you name it, anyone who wants to gets together for a weekend and works on problems in healthcare, solve problems in teams. We do educational seminars, we do luncheons and breakfasts. We host a digital health investment conference next week. And it's not just about the investments, it's also about education. So we do a lot of things in the community, speak at campuses, for instance, and we love it. And we have student volunteers who volunteer at our events. 3 days ago, we had pretty much at least one representative from the C-suite of every single hospital in Dallas in our suite. From THR, the number 2 person, to the CEO of Methodist, to the CEO of the VA here in Dallas. So it's just the type of thing you want to see. And our startups pitch that whole group of hospital executives, because those are all the things you need to have much exposure as possible. Let's keep going. This is one of my favorite slides. This is not including the newest 9, so we need to scoot this to the side and add another 9 logos. But I just like to show this because Lantern Pharma, somewhere right in front of me probably, is on there somewhere, and it had an IPO on NASDAQ. It's all the way over there. And then there's a company down here called Invertex that sold to Nike. And there are many other stories. MediBooker sold to a local company. So these companies continue to have an impact, and it would take us way too long to go into what they all do, but they are in the digital health, in the medical device space, and in the pharma space. So this is my handoff to Java. And so my take home just is, I want you to know that Health Wildcatters organization has an investment piece to it, and we need those people who help us do what we do. And then with the help of these sponsoring organizations, that gives us the opportunity, come on in. There's plenty of stuff. Gives us the opportunity to do all sorts of cool stuff that we're passionate about. And this initiative and collaboration is something we're really excited about. So with that, I'm just hand it over to Javan to tell you about the WISH initiative that, yeah, is anything that's urgent.
Morning.
Good morning.
Good.
Good.
Who loves STEM? I think we all do. Right? So my name is Rosalyn Castellanos. I'm with Dr. Hebert's team at Health Wildcatters. I'm very excited to be there. It's a great space to be in the middle of health innovation, healthcare, and STEM, really, because all the things that we look at are surrounding STEM. So one more slide, Mike. Thank you. So, yeah, but you can that way for the rightness. Okay, wonderful. Just a really quick overview about me. First generation student, I started at Dallas College, transferred to SMU where I got my undergrad in biology. And then I got a master's in molecular and cell biology, which I wanted to be a doctor. Didn't become a doctor, but I'm excited to be in the space that I am. And then I got a healthcare, a master's in healthcare leadership and management, passionate about healthcare, went to SMU and UTD. As you see here, my passion is healthcare, community, and health innovation. And so play the violin, love reading, love orchestra, and I love space and anything to do with STEM. I also love coffee. So that's a little bit about me. And my family is from Guatemala. So always very excited to be in a space where we can all kind of be passionate about STEM, healthcare, and obviously health innovation. One more slide. Thank you. So what is the WISH Network? The WISH Network is the Women in Science and Healthcare Network, as Dr. Hebert mentioned earlier. And our goal is really to support women and really anyone in science and healthcare who may be interested in healthcare entrepreneurship. So you might be right now in, how many of you are like biology majors? Okay. How many of you are engineering majors? Okay. How many of you are technology or like IT? Cool. So we have a good breakdown. So a lot of the times you can pursue these careers and go into your career, start working for a company, but you may have an idea for a company, right? You may be in the space, you may be working on a project and you find a problem and you say, you know, what if we did things this way? And so what we want to do with this is really provide examples of individuals who have been in the room, who have been in these spaces, or who have worked at a healthcare system, who were a nurse and then launched their company, or providers who made that leap into entrepreneurship and really understand how they did that. Because I feel like we all have ideas every single day and we want to make companies out of them, but we don't know how to. And so what we want to do is create a community of like-minded individuals, passionate about STEM, passionate about healthcare, who can really understand how to make that leap into entrepreneurship, have the resources, connect with other individuals who may have similar ideas, and also bring in stories of other founders who might have been in our same shoes, who actually launched their companies. And so with the support of the Health Wildcatters Network, we hope to do that with you all and really being able to create a space where we learn about entrepreneurship, but also STEM in the same room. So slide. Okay, so what is our goal? Our goal is to increase entrepreneurship in science and healthcare to really for anyone. To also access resources, mentorship, networking, professional development, and funding navigation. When you start your companies or your startups, there's a lot of need, like Hubert mentioned earlier, for money, right? How do you begin your idea? So there will be a need for funding. And so what we hope to do is provide those opportunities to include how to navigate grant writing, how to reach out to investors. And Health Wildcatters already has a network of investors who one day you can present your idea to and hopefully get investment. And then also engage with a community of like-minded individuals in this robust innovation ecosystem. So that's what we're trying to do. And we were very excited to partner with UNTD and Dr. Hamilton and Ian to be able to make this happen on this campus. And so, yeah, we will have a series of in-person and virtual events. So we'll be working with Ian and making sure that we have you all will be informed of our next event where we bring in a speaker or a panel to talk about a subject in STEM. So again, just giving a brief overview, our focus is really mentorship and networking, access to financial resources for your startups one day, federal funding, education, inspiration, and training. We hope to build a strong startup community. So when you all get an idea, or if you have an idea, how do you get that to market? How do you start building your business model? Collaboration, annual Wish Summit and engagement, which we would like to plan a Wish Summit eventually. So we'll give you all information when that comes about. But this is basically what we hope to do with the Wish Network and Health Wildcatters with their support. And so, yeah, that's kind of a brief overview. We've had a variety of speakers from Dr. Lauren Tyra, who is actually a partner at Health Wildcatters, part of the GPG venture group that helps invest in some of these startups. Maddie Hegg, Tessa Hoskin, Dr. Gabby Everett. She's also a woman in STEM who has at BioLabs, she is a director of development and business development. And then we have a number of different entrepreneurs. Dr. Lindsay Harper, she was a provider, a doctor at, I believe, was it Methodist or Texas Health Resources? One of those two health systems. She had an idea and now she's a full-time entrepreneur. And so, yeah, these are pictures of different events we've had in the past, and we're excited to have those similar events here on campus. And that is it. Thank you.